From doctors who write prescriptions to themselves to nurses who may steal medicine meant for patients, drug diversion is a huge problem in the medical community.
Atlanta News Force investigator Sierra Cummings joins us in studio. And Sierra, there are hundreds of medical providers disciplined for this behavior.
Yeah, that's correct. And we have many here in Georgia, and sometimes they can slip through the cracks. In partnership with our national investigative team, we uncovered hundreds of examples where medical staff push pills in the wrong direction. Here's national investigative reporter Josie Sturman with Diverted.
I work for them. I was proud to have worked for them.
You think of it as top-notch health care?
Absolutely.
When Sori Ellis Henry and her husband decided to expand their family, Yale seemed like a no-brainer to help them become mom and dad once again.
So this was our name bands, and we went to the clinic, the medicine that I had to take shots.
After enduring the grueling early stages of fertility treatment, the couple was filled with hope on Retrieval Day, where physicians surgically remove mature eggs from the ovaries for fertilization. The procedure is typically done while women are awake and is supposed to bring little to no pain.
Something was clearly wrong.
Scale of 1 to 10, how bad was the pain?
It was over a 10. It was horrific.
The reason? Court records show that for months in 2020, a nurse at the clinic she visited had been secretly stealing fentanyl from the medical supply, draining the drug vials for her own use, refilling them with saline and putting them back on the shelf. So instead of getting a potent painkiller during their procedures, at least 95 patients got salt water.
I was shocked. I was relieved to know what happened, and then the anger kicked in.
It's called diversion, where medical professionals channel medications away from their intended legitimate purpose for illegal use or distribution. Our national investigative team found dentists, nurses, and doctors of all kinds doing it across the country. We looked at disciplinary records for regulatory boards nationwide dating back to 2018. We found nearly 300 medical professionals who've been punished for diversion.
When you start putting letters before and after somebody's name, they're looked at differently.
Ian Icavello knows. He worked on an FBI task force investigating diversion cases and healthcare fraud. We took him dozens of egregious examples we found in disciplinary records. They include a doctor getting his partners to sign blank prescriptions so he could stockpile hundreds of pain pills for himself. A dentist who wrote prescriptions for sedation drugs for dozens of patients she never saw. Another who ordered thousands of Xanax through a dental distributor to fuel his own habit. And our national investigative team got exclusive access to the wiretaps and undercover footage used in the DEA's Operation Wasted Days sting in Texas. The sting captured a network of recruits on video, part of a multi-million-dollar pill mill run by two doctors writing prescriptions for controlled substances for cash. Their diversion finally busted by someone who spoke to authorities.
Unless somebody steps out of that closed environment and says, I think you all need to hear this, there's really nobody.
This is a proud daddy holding his baby.
In Sori Ellis Henry's case, instead of cries of agony from patient after patient, it was somebody who noticed a loose cap on a fentanyl bottle that put a stop to diversion at the Yale Clinic.
It broke my trust in the healthcare system. I just didn't understand, even as a nurse, and how that could have happened.
And that was Josie Sturman reporting there. A Yale representative says they have new measures to ensure clinics have safeguards. The university recently settled a lawsuit brought by the victims at this fertility clinic. The nurse involved pleaded guilty and surrendered her license. Here in Georgia, since 2018, we found 8 medical workers whose license were suspended, surrendered, or restricted as a result of drug diversion. That's 5 doctors and 3 nurses. In the studio, I'm Sierra Cummings for Atlanta News First Investigates.